I'm here with Dr. Tim Tuccaro, Professor of Environmental Science at Simon Fraser University, with a special interest in indoor environments and their effect on health. So, Dr. Tuccaro, can the indoor environment be designed to reduce asthma?
Yes, we believe that the indoor environment can be designed in a lot of different ways to reduce asthma. We've been involved in designing and building homes specifically for asthmatics in Seattle, and the research suggests that children with asthma do much better in a specially designed home.
Are those interventions expensive?
They don't have to be. So it's expensive to build a home, but if you use, say, energy saving design as a base, then the additional asthma features on top of your new home costs are only $5,000 to $7,000.
Worth it in the long run instead of taking your child to the emergency department frequently.
Absolutely. You can even calculate the savings over a few years just in the maintenance therapy, steroid inhalers, for example.
And what about the outdoor environment? Can that be managed as well to reduce asthma?
Well, again, we have demonstrated that air pollution increases asthma exacerbations, and that regulation can reduce air pollution. So I think with that, we don't have the definitive study of, like the smoking literature has, of you put in a smoking ban and you can watch people get better. We have not done a study, to my knowledge, in a before and after regulation scenario where you regulate air pollution, have a measurement before the regulation is promulgated, and then afterwards to show that children indeed have reduced asthma. But it would certainly follow logically based on the data that we do have.
Do we have experience with interventions that have proven ineffective?
Much experience. I think the bottom line on ineffective interventions is that to be effective in asthma, you have to have a multifactorial approach, because asthma is a multifactorial disease. So if you just focus on dust mite, for example, you get very little bang for your buck. If you just focus on cockroaches, if you just focus on mold, you'll maybe see a little impact if the study is large enough. But when you do a comprehensive intervention across all of those triggers, then you see consistent response that's positive.
So is there anything that we should not do? Should we avoid?
Well, yes. Probably the worst thing that one could do is get an ozone-producing air cleaner. It's amazing that these are still on the market. They exacerbate asthma, and they're marketed as an air cleaner. So it occasionally happens that families of asthmatics go out and buy an ozone-producing air cleaner, and of course that's the wrong direction.
So what should we do?
So there are a range of interventions that can be tried, starting with simple education and educational materials that's been shown to be effective, and community health workers going into the home to help a family learn how to change their behavior with regards to cleaning or moisture management, ventilation. All of those are pretty inexpensive. And then, of course, at the high end would be the Breathe Easy home, a home that's designed from the ground up as asthma trigger-reduced home. So in this range of interventions, there's effectiveness shown at each level, and it's a matter of how much do you have to spend and how severe is the asthma. So maybe your asthma is not so bad. A few visits with a community health worker and some educational materials might be enough. Whereas if you have intractable asthma, maybe Breathe Easy Home is going to be what takes you to the next level of treatment.
I suspect that most parents would be willing to go the extra distance for the health of their child.
Yes, absolutely. Especially parents who have an idea of what's ahead of them with regards to the midnight visits to the ER and missing school, missing work, etc., that goes along with caring for a child with asthma.
Any chance that any of these interventions for a Breathe Easy Home are going to make it into building codes?
Well, that's, of course, a very important question. We certainly hope so. It's still early days, I would say, for the Breathe Easy Home. A lot of what we're recommending is already recommended, but it's a matter of evolution in construction. And I think everyone from Vancouver knows the leaky condo story. The leaky condo story is one that involved not just design issues, but probably more important, the actual contracting, construction. That has to be followed as well. It's always amazing to me when you see a house being built and the lumber is stacked outside in the rain, getting completely soaked, and then you put it into a home and cover it up. If you know anything about mold and building materials, this does not make sense.
No.
And it is simple things like that that can improve the health of a home.
So if people were more aware and had better practices?
That would certainly help. The building codes are important and they need to be strengthened, but also they need to actually be enforced in the field. And I think you can design the most fabulous tight home with good ventilation and moisture proof, but if it's built wrong, that design will fail.
Interesting. Thank you, Dr. Takaro.
Thank you.